Hello, my Facebook followers. I'm glad you're following and I'm happy with the way you are engaging on my posts. I'm so grateful. I want to encourage you to do more. Anytime you see my videos, kindly show love by reacting to them and commenting. It goes a long way to encouraging me to do more. So today there is an important and essential something, essential stuff, something that you need to have in your house, no matter what, as a parent, as a caregiver. In fact, it is something that is very important. I think the schools should also have it. At least, even if you don't have nurses in your school who work to take care of the children, but you should have it in your safety box, or maybe let's say first aid box is very important. I need every one of you to listen to this very well. Listen to the end because you have a lot to learn and to take from this video. And what I'm talking about that every parent, every caregiver should have is ORS. ORS. A sachet of this can do wonders, especially when your children or when you yourself as an adult or as a parent is having vomiting, or maybe you are going to the toilet, you have diarrhea and all of that. You know, there is one thing that people don't actually know. They just feel vomiting and diarrhea. There's nothing there. There is something there, much more there. When you are vomiting, when you're having diarrhea, you know, it makes you to lose a lot of water, a lot of fluid. You'll be losing a lot of fluid because as you're vomiting, you are not taking anything in. Everything in your system, you're just bringing them out. All the fluid, all the electrolytes are going out from your body. So when you continue vomiting, continue stooling, it can make you lose a lot of water and expose you to what we call dehydration. And dehydration can be very terrible. There are so many people who have died from dehydration. Maybe after some couple of hours of vomiting and of stooling frequently, they just end up dying. I am a medical worker. I'm a health practitioner, and I've seen a lot of times where parents rush their children to hospitals, and before they get there, the children are already weak and they just die. And we ask them what happened. They say, since morning, she don't dey vomit, she don't dey go toilet. Every minute they go toilet, just they vomit. And you did not rush the child to the hospital, and you did not even give the child ORS. Some parents don't know about this, and I really need to say something about it so that we can learn. There are a lot of deaths that should have been prevented if we knew these little things. Now, this is ORS. This is ORS solution. I don't want to show the producer because I'm not paid to advertise for them. So this is an ORS sachet that you have to reconstitute to give to a child, especially a child that is vomiting and or is vomiting and stooling at the same time. You need to prepare this ORS. As you prepare it, I did not say prepare it and stay behind in your house. As you prepare it while you're going to the hospital, maybe especially you have your house is far from the hospital, you need to get it prepared and be administering to your child, at least to replace the fluid he or she is losing from vomiting and diarrhea. Give the child the ORS solution. Let him be drinking, be sipping it, and so that the electrolytes he's losing will be going back and he will not be dehydrated, because dehydration can be very fatal. It's very bad, and people can die from dehydration in few hours. Yes, I said so. If you doubt it, you can ask around, ask any practitioner, any medical worker, and they will tell you and confirm this thing I am telling you today. So we have seen a lot of times where children just die carelessly from vomiting, from going to the toilet, or stooling, or diarrheating, and it just goes on like that. And most of this thing happen because of ignorance. They don't know. The parents don't know that there's anything called ORS, that there's something that they need to be given to the child before they get to the hospital. And it is very important. Vomiting and diarrhea can quickly drain you of all the fluids in your body, in your system, in few hours, just few hours. And before you know it, the major organs of the body just pack up and the person is gone. just few hours. I'm not talking about days now. So you need to have this at home as a parent, as a caregiver. Have it at home. Even as for you yourself, there is sometimes if I have maybe abdominal issues and all of that, maybe I had to go to the toilet more than normal. Sometimes I just mix it up and take it, sip it, so that all the electrolyte that might have been lost will be regained. When you vomit, when you diarrhea, you lose fluids, you lose potassium, electrolytes, important electrolytes. You lose them. You lose glucose. And this can actually affect you and make you become weak and become dehydrated. And dehydration can lead to so many other complications, even death. So please get it. And how do you reconstitute this? Because some women, they don't know how to reconstitute it. This sachet, one sachet of ORS should be reconstituted in 1 liter of water, clean water. I usually advise the table water because all these sachet water that they are selling, I don't trust them. So you can get table water. This is the big bottle, and it is 150 cl, which is 1.5 liters. But what you need for this sachet is just 1 liter. So what you do, if this is what you purchased as a table water from the shop, just reduce it. Then you can reduce it up to this mark and add your ORS solution. You mix it well, shake it very well, let it be combined well, and you give to your child to sip. Or you yourself, you can be sipping it from time to time. Don't say because, oh, even after sipping I still vomited. It is not bad. As you keep taking it, at least some fluids are also going back to your system. It's not like when you are just vomiting uncontrollably and nothing is entering your system back. That is a no. And as you are doing that, you are also making provision to go into the hospital immediately. So this ORS is just like a first aid. It's something you should do before you get the help of doctors or nurses, or you go to the hospital. It is very, very important for you to have it. And if you are still confused as to getting the liter mark, or maybe when you buy this 150 cl, you don't know the actual place where the 1 liter is, I would encourage you to go to the market. You can buy these plastic jugs or cups that are calibrated. You see them, they write 1 liter here, 2 liter here, 3 liter here, and all of that. So you buy them, you can use it to measure before you reconstitute the ORS solution. So that is it. You need to get it because it will help you to rehydrate and help you to retrieve or get back the electrolytes you might have lost during the process of vomiting and diarrhea. So now, I believe you are able to learn something. If you don't have it, please buy them. I'm not saying that I'm wishing your children sickness. Myself, I'm a nurse. I have them at home because I know anyone who has children, sometimes from time to time, they can fall ill. They can have some kind of, let's say, cold or whatever that will make them to have some symptoms that would make them lose a lot of fluid. So you need to get that. You need to get that. You need to get the ORS. Get it. Keep it in your house. And I encourage schools as well to adopt this kind of thing, because before you are able to call or to reach out to a parent that their child or their children are having issues or they are vomiting and diarrheating, before they could drive from their place to the school, time might have gone. So schools are encouraged to have this ORS in their first aid box. It's something that they can easily prepare. It's not something you don't need to go to school for you to know how to reconstitute it. Just have the measurement of 1 liter of clean water. Then you reconstitute it, shake it well, and be given to the child before the parent will get to the school to pick them to the hospital, or before you take your child to the hospital. While you are in the car or anything that is transporting you to the hospital, the child should be sipping it so that he doesn't break down and become too weak or lose a lot of water and become dehydrated. So you can prevent so many problems, so many complications just with a sachet of ORS. Please share this video. Tell somebody, let them learn from this. Thank you so much. Till we meet next time.